Well, when we talk about medication, we have to divide it into medication which are used to treat sexual problems and medications which are used to treat Parkinson and can affect sexual functioning, okay? So if we talk about medication which treat sexual problems, the most famous one, which you probably all know, is the medication for erections. We're talking about the Viagra, about the Cialis, and about the Levitra. These three ones made really, I would say, revolutions in the world of sex therapy. Now, what is very important is, first, these medications are fantastic for people with Parkinson. They are really good. They really help men to get a better erection. And it is good, one of the reasons it is good is because of the example I gave you before. Let's say that the man is aroused and he tries to move and he loses his erection. The medication will help him to regain the level of arousal very quickly. This is important. It also helps the woman, because if I am with a man who doesn't have erection, sometimes it influences me. I don't feel very attractive. Maybe I don't feel a very aroused atmosphere. So it helps also the woman to be more focused in her arousal. But we have to remember one thing. Many people with Parkinson find that there is a difference in the time elapse between taking a medication, whatever medication, until it is in their blood, until the level in this blood is proper. It is true for all kinds of medications. If you are a PD patient, Parkinson patient, and you have a slowness of your gastric activity, then when you take the medication, you need to wait longer than the usual instruction that the doctor gives you. Let's say that he tells you take the pill and wait 1 hour. Maybe you have to wait 1.5 hours. Maybe you have to wait 2 hours. How do you know? Take the first pill. After 1 hour, try to get aroused. Better don't do it with your spouse, because she doesn't have to wait and look at the clock. Okay, now, after 1 hour, maybe by yourself, try to do self-stimulation, if it is okay with you. And then you can really monitor the proper time when the pill is absorbed in your body. For some patients, according to my experience, it takes 2 hours, sometimes 2.5 hours. Some of my patients wake up in the middle of the night because they have to go to the bathroom, and then they take the pill because they found out that after 2 or 3 hours, they are okay with it. So that when they get up in the morning, they can have sex as they used to have. I mean, those who do it in the morning. So you have to do a calculation of the timing. Now we have other kind of medication, which are the Parkinson medication. So we have the medication for the Parkinson itself, which are usually dopamine agonists. They make you feel better. They make you enjoy life better. And sometimes they make you even feel more sexier. I mean, have higher desire. We have to follow it and to see only if you have the proper desire and if it is not too much. I mean, too much, it means that you are hyper in your sexuality or you are inhibited in your sexuality, and then we have to balance it with other medications. Other than this, the other medications, which are relaxing, and we mentioned already, can reduce the way you react to sexual hints, to sexual excitement, and again, we have to follow it. I think that these are the main issue, but what we have to know also that there are other medications. Today we have hormones which help desire get better. We have lubricants which help the sexual contact between the male organ, the penis and the vagina, be smoother and nicer, especially when the woman is on menopause. We have hormonal treatments for people in menopause. So we have really many treatments. Just find the proper professional counselor and you will get the assistant.